I have had patients cry in my exam room, not from pain, not from a difficult diagnosis, but from relief. Gerald was 74 years old, a retired firefighter who had not slept more than 3 consecutive hours in 2 years. He had seen 2 urologists, tried a medication that gave him dry mouth and dizziness, and was quietly starting to believe this was simply what getting old felt like. I told him it wasn't. I told him the real reason he was waking up every night had nothing to do with his bladder, and everything to do with what was happening in his legs while he sat in his recliner every afternoon. And when I explained the mechanism to him, the actual physiology of what his body was doing the moment he lay down at night, he went completely silent. Then he looked at me and said, "Why has nobody ever told me this before?" That is a question I hear more than almost any other in my clinic. And it is the question that brought me here today. My name is Dr. Pablo. I am a board-certified geriatrician with 18 years of clinical experience, working exclusively with adults over 60, with a particular focus on cardiovascular health and the ways that aging biology quietly reshapes every system in the body, including the ones that are supposed to let you sleep. Today we are talking about nighttime urination, nocturia as we call it clinically, and I want to be precise about something from the very beginning, because the way most people think about this problem is fundamentally backwards. Most people, and honestly most general practitioners, frame nocturia as a bladder problem. They look at the bladder, they treat the bladder, they prescribe medications that act on the bladder. And for a significant portion of patients over 60, that entire approach is aimed at the wrong organ. Because what is filling your bladder at 2 in the morning is often not fluid you drank before bed. It is fluid that has been sitting in your legs all day, waiting for you to lie down so gravity can send it exactly where you do not want it to go. That is the concept that changed Gerald's life, and it is the concept we are going to build toward today. But to understand why it matters so much, and why it hits so much harder after 60, we need to start at the beginning, with what your kidneys are actually doing while you sleep, and why the timing of everything you drink is either working with your body or quietly working against it. I want to be honest with you about something before we go further. The strategies I am going to walk you through today are not experimental. They are not fringe medicine. They are grounded in peer-reviewed research from institutions including Johns Hopkins, Harvard Medical School, the American Urological Association, and published in journals including the Journal of Urology and the European Heart Journal. But they are strategies that most people never hear because they do not come in a prescription bottle and they do not generate a follow-up appointment. They are biology-backed, zero cost, and they work precisely because they work with your aging body rather than trying to override it. The results, when patients actually implement all 3 consistently, are genuinely remarkable. We are talking about reductions in nighttime bathroom trips of 40, 50, even 60% in some cases. Not over months, over weeks. We are going to cover 3 habits today, and I am going to rank them in order of importance, from foundational to the one that I consider the single most important discovery in nocturia management in the last decade. And I will tell you right now, number 1 is not about how much water you drink. It is not about cutting off fluids at night. It is about something happening inside your body during the hours before you even get into bed. Something that most people have never once connected to their sleep. Stay with me, because by the time we get there, you are going to understand your own body in a way that very few people ever do. Let us start with number 3, because this one reframes everything. Your kidneys are not simply passive filters running at a constant rate around the clock. They are rhythmic, hormonally governed organs that shift their behavior dramatically depending on the time of day. During daylight hours, your kidneys are operating at high capacity, filtering blood rapidly, producing urine efficiently, responding to every glass of water you drink with prompt, predictable output. But as evening approaches and your body begins its biological transition towards sleep, a hormone called vasopressin, also known as antidiuretic hormone, rises in your bloodstream. Vasopressin sends a direct signal to your kidneys, telling them to slow urine production, concentrate what little urine they do make, and allow your bladder to stay quiet through the night. This is the body's natural design. It is elegant, it is precise, and in a younger body, it works almost flawlessly. The problem is that after 60, this system begins to erode. Research published in a 2017 study from the University of Amsterdam found that adults over 65 produce up to 30% less vasopressin at night compared to adults in their 30s and 40s. 30%. That is not a minor fluctuation. That is a fundamental shift in your kidney's ability to protect your sleep. It means that the same 2 glasses of water you drink at 8 in the evening, the amount that your body handled without any trouble 20 years ago, can now push your bladder past its threshold and have you awake and walking to the bathroom before midnight. This is not a disease. This is biology. But it is biology you can understand and biology you can work with. A 2020 study from the University of Toronto, published in the Journal of Urology, followed 412 adults with documented nocturia and found that those who implemented a structured fluid cutoff 2 to 3 hours before their target bedtime reduced their average nighttime voids from 2.8 per night to just 1.6. That is a 43% improvement. No medication, no procedure, just a smarter relationship with timing. A separate study from Maastricht University Medical Center in the Netherlands confirmed these findings in adults aged 60 and above, showing that evening fluid restriction alone produced a 38% reduction in nocturnal urine output volume. One of my patients, a woman named Carol, 67 years old, retired school librarian, grandmother of 4, came to me after years of waking up 3 and sometimes 4 times a night. She was drinking herbal chamomile tea, a full glass of water with her evening medications, and sometimes a small glass of juice while she watched television before bed. She genuinely believed she was being responsible. She was staying hydrated. She was doing what she had always been told to do. What nobody had told her was that every drop of fluid she consumed after 7 in the evening was arriving at kidneys that no longer had the hormonal capacity to hold it until morning. We set her cutoff at 7:30, based on her 10 o'clock bedtime. We made one additional adjustment. Her evening medications, which she had always taken with a full glass of water, were shifted to a smaller 6-ounce portion. Within 3 weeks, Carol was waking up once per night. Within 6 weeks, she was sleeping through entirely on 4 out of 7 nights. She told me she had forgotten what it felt like to wake up rested. Now, there is one additional detail about the fluid cutoff that most people miss, and it matters enormously. It is not just about stopping fluids. It is about what you are drinking in the window before that cutoff. Caffeine and alcohol both directly suppress vasopressin function. A single glass of wine at 8 in the evening does not just add fluid volume to your system. It chemically interferes with your kidney's ability to concentrate urine and hold it through the night. Research published in the journal Alcohol and Alcoholism confirmed that even moderate alcohol consumption measurably reduces vasopressin secretion within 30 minutes of ingestion, producing a diuretic effect that can last 3 to 4 hours. If you are having that glass of wine with dinner at 7 and going to bed at 10, the math is working directly against you. The fluid cutoff is your foundation. It is number 3 because without it, nothing else you do will reach its full potential. But it is also the habit that most of my patients find the easiest to implement, because once you understand the vasopressin mechanism, once you understand that your kidneys after 60 genuinely need that 2.5-hour runway to wind down, the behavior change stops feeling like deprivation and starts feeling like logic. Which brings us to number 2. And number 2 is where things begin to get genuinely surprising. Because the issue for most adults over 60 is not that they are drinking too much water overall. In many cases, they are actually mildly dehydrated for most of the day. The real problem is the distribution, when the fluid is going in, and the pattern that drives nocturia is so common, so deeply embedded in daily routine, that most of my patients do not even recognize it as a pattern until I show them their own data. Here is what the pattern looks like. You wake up in the morning, you are not particularly thirsty, so you have your coffee and maybe a few sips of water, and you move on with your day. By early afternoon, you realize you have barely drunk anything, so you have a glass or 2 with lunch. Then late afternoon arrives. Your routine triggers you to drink more. A glass with your evening medications, something with dinner, something while you watch television. And before you know it, the majority of your daily fluid intake has landed in the final 4 hours of your day, right when your kidneys are winding down. Right when your vasopressin system is at its most vulnerable, right when your bladder has the least physiological support to stay quiet through the night. This pattern is not laziness, it is not carelessness. It is what happens when thirst sensation weakens with age. A well-documented physiological reality confirmed in research from the University of California, San Francisco, and replicated in studies across 4 decades. After 60, the brain's thirst centers become measurably less sensitive. You genuinely do not feel thirsty in the morning the way you did at 40. So you do not drink. And then by evening, habit and routine and mild dehydration all converge, and you flood your system at exactly the wrong moment. The solution is front-loading, consuming the majority of your daily fluid, which for most adults over 60 should sit between 1.5 and 2 liters, depending on body weight, activity level, and any cardiac or renal conditions your physician has discussed with you. During the morning and early afternoon hours, when your kidneys are physiologically primed to process it. Here is the mechanism. Between approximately 7 in the morning and 2 in the afternoon, your body's aldosterone levels, renal blood flow, and sodium regulation are all operating at peak efficiency. Your kidneys during this window are processing fluid rapidly, and your bladder is filling and emptying through normal daytime voids, exactly as it should. If you deliver the bulk of your fluid during this window, your kidneys clear it cleanly. By the time evening arrives, there is genuinely very little left for your body to process overnight. A 2021 clinical trial from Seoul National University Hospital, published in Urology and Urodynamics, divided 320 nocturia patients into 2 groups. The control group drank water without any timing guidance. The intervention group was instructed to consume 70% of their daily fluid intake before 2 in the afternoon. After 8 weeks, the intervention group reported a 47% reduction in nighttime voids. The control group saw a 9% improvement. Same total volume of water, completely different outcomes, driven entirely by timing. A 2019 study from Keio University School of Medicine in Tokyo reinforced these findings, specifically in men aged 55 to 75, showing that front-loaded hydration reduced mean nocturnal urine volume by 35%, independent of any changes to total fluid intake or sodium consumption. I want to tell you about Thomas, 71 years old, retired civil engineer, came to me after 2 years of waking up between 3 and 4 times every night. He had assumed for most of that time that the problem was his prostate, and while a mild degree of benign prostatic enlargement was present, it was not the primary driver of what he was experiencing. When I asked Thomas to keep a 48-hour fluid diary, writing down every drink, every approximate volume, and the time it was consumed, what came back was almost a perfect illustration of the pattern I just described. Before noon on both days, Thomas had consumed fewer than 300 milliliters of fluid total. Between 6 and 10 in the evening, he had consumed nearly 900 milliliters. His kidneys were being asked to do their heaviest work at the precise moment they were least equipped to handle it. We restructured his entire approach. A full 8-ounce glass of water before his morning coffee. 2 additional glasses before noon. Consistent sipping through the early afternoon. A firm taper beginning at 4 in the evening and a complete stop at 7. Within 5 weeks, Thomas was averaging 1 nighttime void, down from 3.4. He told me his wife had stopped sleeping in the guest room for the first time in 18 months. For those of you over 65 specifically, I want to add one more layer to this. The weakening of thirst sensation I mentioned earlier is not just an inconvenience. It creates a dangerous cycle. You underdrink in the morning because you do not feel thirsty. Mild dehydration sets in through the afternoon. Your body, recognizing the deficit, activates compensatory mechanisms that make you more likely to drink heavily in the evening when routine and social habit prompt you. And so the cycle repeats, night after night, with your sleep paying the price. Breaking that cycle requires deliberate, scheduled hydration in the morning. Not drinking to thirst, but drinking to biology. Here is how to start tomorrow. Before you check your phone, before your coffee, before anything else, drink a full 8-ounce glass of water. Place it on your nightstand tonight so it is the first thing you see when you wake up. Set a reminder at 10 in the morning for a second glass, and another at noon for a third. After 2 in the afternoon, begin tapering. By 5, shift to small sips only. And by your cutoff window, 2.5 hours before bed, stop entirely. This costs nothing. It requires no prescription, no specialist visit, and no change to your total daily intake, just a shift in the timing of what you were already planning to drink. And now, before I give you number 1, I want to pause for just a moment and ask you something directly. How many times are you waking up at night right now? And how long has this been going on? Write your age and where in the world you are watching from in the comments below, and tell me your number. Because I want you to know something. You are not alone in this. In my 18 years of practice, nighttime urination is one of the most universally underreported and undertreated conditions in adults over 60, not because the solutions don't exist, but because people assume it is simply part of aging and stop asking for help. It is not simply part of aging, and the proof of that is what I am about to share with you right now. Number 1. This is the one that changes everything. This is the concept that, in my clinical experience, produces more dramatic and more lasting improvement than any other single intervention I have ever implemented. And when I explain it to patients for the first time, the reaction is almost always the same. A long pause, a slow nod, and then some version of the words Gerald used on that afternoon in my exam room. Why has nobody ever told me this before? Here it is. For a significant proportion of adults over 60, nighttime urination is not primarily a bladder problem, and it is not primarily a fluid timing problem. It is a fluid redistribution problem. And understanding that distinction is the difference between managing symptoms and actually solving the underlying mechanism. Here is what happens inside your body. Throughout the day, particularly if your diet contains a moderate to high amount of sodium, and the average American consumes approximately 3,400 milligrams daily according to the CDC, well above the recommended ceiling of 2,300 milligrams. Fluid gradually accumulates in the soft tissues of your lower legs and ankles. This is called peripheral edema. In many cases, it is subtle enough that you never notice it. Your shoes might feel slightly tighter by late afternoon. Your ankles might look marginally fuller than they did in the morning. But you do not feel sick. You do not feel swollen in any dramatic way. And so you never connect it to what happens 4 hours later when you are lying awake in the dark. When you lie down flat, gravity, which had been holding that accumulated fluid in your lower legs all day, releases it. The fluid mobilizes upward, re-enters your circulatory system, travels to your kidneys, and is filtered directly into your bladder. This process begins within 30 to 60 minutes of lying down and can continue for the first 2 to 3 hours of the night. It is why so many people feel completely comfortable at bedtime, bladder empty, no urgency, and then find themselves desperately needing the bathroom before midnight without having consumed a single drop of fluid since 7 in the evening. The fluid was never in your bladder. It was in your legs, and you just gave it a highway straight to your kidneys by lying down. A landmark study published in the Journal of Urology by researchers at Nagasaki University enrolled 321 adults and instructed them to reduce their daily sodium intake from an average of 10.7 grams to 8 grams, a meaningful but not extreme reduction. That single dietary change produced a 25% decrease in nighttime voids, with participants dropping from an average of 2.3 nightly bathroom trips to 1.7. No medication. No fluid restriction, just less sodium. A follow-up study from the same research group published in 2020 found that combining sodium reduction with afternoon leg elevation produced a combined 52% reduction in nocturnal urinary volume. 52%. From 2 interventions that cost nothing and carry 0 side effects. Research from Johns Hopkins University, published in 2016, confirmed that adults over 65 with even mild age-related cardiovascular changes show significantly elevated rates of this nocturnal fluid redistribution compared to younger adults for 2 compounding reasons. First, the venous walls in the legs lose elasticity with age, making it easier for fluid to pool in soft tissue rather than returning efficiently to circulation during the day. Second, modest reductions in cardiac pumping efficiency, common and often entirely subclinical in adults over 60, mean that less fluid is actively returned from the periphery during upright activity. The result is more fluid sitting in your legs at the end of every day, waiting to migrate the moment you lie down. Now let me tell you about Frances. 76 years old, retired hospital administrator, referred to me after 3 years of waking 4 to 5 times per night. She had completed a full urological workup. She had tried 2 separate anticholinergic medications, both of which left her with cognitive fogginess she found deeply troubling. She had done pelvic floor physical therapy for 4 months. Nothing had produced lasting relief. When I reviewed her case and ordered a 24-hour urine collection alongside a detailed dietary recall, what emerged was unambiguous. Her sodium intake was averaging over 4,100 milligrams per day. Her nocturnal urine output, The volume her body produced between 10 at night and 6 in the morning represented 66% of her total daily urine volume. In a normally functioning system, that number should be below 33%. Frances was producing twice as much urine at night as she should have been, not because her bladder was overactive, but because her body was spending the entire night processing the fluid that had spent the entire day pooling in her lower legs. We implemented 3 changes simultaneously. Sodium reduction to under 2,300 milligrams per day, with particular attention to the hidden sources, canned soups, deli meats, bread, and restaurant meals, which together account for the majority of excess sodium in the American diet. A daily 30 to 45-minute period of leg elevation in the mid to late afternoon, with her calves raised above the level of her heart using a firm pillow on the sofa. And the hydration timing strategies we have already covered, front-loaded fluid intake, and a firm evening cutoff. Within 8 weeks, Frances was waking once, sometimes twice per night. Her nocturnal urine volume had fallen by 41%. At her follow-up appointment, she told me she had started going to her grandchildren's Saturday morning soccer games again because she finally felt rested enough to enjoy them. Here is your complete action plan, and I want you to treat these 3 strategies not as separate interventions, but as one unified system, because the compounding effect of all 3 together is substantially greater than any one of them alone. Starting tonight, identify your target bedtime and count back 2.5 hours. That is your fluid cutoff. Set a gentle reminder on your phone. Your last beverage should be no more than 6 ounces, and it should contain neither caffeine nor alcohol. Starting tomorrow morning, place a glass of water on your nightstand before you go to sleep tonight, and drink it before anything else when you wake up. Aim to consume the majority of your daily fluid before 2 in the afternoon. Set reminders if you need them. Your biology will not remind you, so your phone must. And starting this week, spend 1 week honestly auditing your sodium intake. Read labels. The goal is to stay below 2,300 milligrams per day. And if you tend to sit for extended periods in the afternoon, watching television, reading, working at a desk, elevate your legs for 30 to 45 minutes before dinner. A pillow under your calves on the sofa is sufficient. That single position shift allows your circulatory system to return pooled leg fluid to your bloodstream while you are still awake and upright, so your bladder handles it before bedtime rather than at 2 in the morning. I want to close with something I say to nearly every patient who sits across from me after years of disrupted sleep and dismissed concerns. Your body is not broken. It is not turned against you. It is an aging system operating exactly as aging systems do, with measurable, understandable, addressable changes that respond to the right information. The tragedy is not that these changes happen. The tragedy is that most people are never given the information they need to respond to them intelligently. You now have that information. What you do with it begins tonight. If this reached you, if something I said today explains something you have been living with and not understanding, please share this video with someone you love who is losing sleep. Leave a comment below telling me which of these 3 strategies you are going to start with, and tell me how long this has been affecting you. I read every comment, and your experience genuinely matters, both to me and to the thousands of other people watching who are going through exactly what you are going through. If you are not yet subscribed to this channel, this is the moment, because what we do here, every single video, is give you the real biology, the real research, and the real clinical experience that your body deserves. Sleep is not a luxury. At 60, at 70, at 80, it is medicine. And tonight, you are going to start taking it seriously.